Traumatic brain injury recovery.
How do we find purpose and meaning in recovery? What can we do with the new me? Find new me, accepting the new me, and using that to our advantage and to the advantage of others? Big question. Number one, let's fix what we can. Let's not say, okay, this is the way it is. It's going to be this way forever. I got this chronic headache. I've got this tinnitus. I've got this chronic depression. I remember somebody early on in my career, a neurologist, who said, well, yeah, they're depressed. They just had an injury. They just had a stroke, and that's life. The implication was you don't do anything about it. You just live with it. Not the case. There are ways. I mean, talking therapy is helpful to help somebody deal with the losses. In certain cases, if it's well thought out, some low-dose antidepressant medications can be very helpful. Now, again, it's not in everybody, but something to consider. As there are other things certainly besides medications and talking therapy. Getting involved with the Brain Injury Foundation, help others get into that. But fix what we can. What do we want to look at? Let's get some lab tests. Make sure that's something easily correctable. Low thyroid hormone, a growth hormone deficiency, and anemia, things like that. It's easy to do. What about imaging? Make sure there's no collection of fluid or bleeding in the brain that could be correctable. What about seizures after the head injury? Has there been an EEG, an electron? What about headaches? Let's get those evaluated and other pain evaluations. Vision, hearing, balance, because there are some treatments that could at least mitigate those things. What about sleep disorders? Common after brain injury. I think a sleep evaluation would be very helpful. And then, of course, review of medication. When people come to me and they are telling me they're anxious, depressed, or having some symptom that one might say is a mental, first thing I say is, let's talk about your current medications. What are you taking? And we'll meticulously go through those meds to figure out what the benefits of the meds are and what the potential side effects are. An individual med is causing a side effect, or a combination of meds are interacting poorly. And often it's the case that taking away meds may be the way to go. Please, before you make any change to your therapy, please discuss it with your healthcare provider. Neuropsychological testing. Why is that important? Because it's complex testing of our cognitive functions, our memory, our attention, our speed of processing, our ability to solve problems, to plan, to organize. And that will tell us where our strengths are and where our challenges are. And based on those findings, the neuropsychologist, the cognitive remediation therapist, often speech therapist, will help us come up with exercises or with compensatory strategies to strengthen those areas or to find workarounds. And then a psychological and psychiatric evaluation. Sometimes it's a biological depression on the basis of brain injury, not because of the other psychological issues I talked about previously, but sometimes it's the losses they're experiencing, the loss of their job and their role in the family and economic and so on. It would benefit anybody to talk about those things and get appropriate treatment.
Okay.
We're talking about finding purpose and meaning. Fix what we can. We talked about lab tests, imaging, EEG, all these different evaluations. Here. Also, if I want to get a good understanding, I try to talk to the spouse, the family member, especially somebody who knew the brain injury survivor before the injury and then since the injury, to see what changes and what areas that make sense. And then often it's nice to have a case manager. Again, we're talking about optimal situation, a case manager involved to help coordinate. Amy was talking about forgetting to go to appointments. This is so common. And so it's great to have a case manager to understand the scope of the issue and then guide the brain injury survivor through a series of evaluation treatments. Before I go on to I want to continue this fixing what we can, keeping up with what's going on in research and treatment. On my website, I do have a page called Traumatic Brain Injury Searches, and that searches the professional literature. And if you want to find out what the latest stuff is, like here's a customized search engine that I put together. You just put in TBI and then the term that you want to search. Let's search depression, TBI and depression, and click on that, and you see the different articles. And then you can follow these articles and see the summaries of the article, and at least to give you an idea of what's going on, what the research is, what certain new treatments there might be. There's the customized search engine, but lower on the page are filtered searches. I've set up these searches filtered by keywords, so if you want to find out what the latest in TBI diagnosis is, we'll click here.
Someone was asking, is this more for professionals or survivors? And I think my response would be, it's really for anybody. It's tons of information. It's just kind of a search engine.
Let's say you have a symptom, and I'm scrolling down here, let's call it hyperactivity. You could at least click on this and find some literature and say, oh, that's an interesting thing. I'll make some notes about this and I'll discuss it with my neurologist or whomever.
Dan, just real quick, someone was asking about your website, and that's dangardnermd.com, correct?
That's correct, www.dangardnermd.com. In adjusting to the injuries, we can. It's very important. And even if that's years afterwards, I've seen patients who are decades afterwards who have had untreated, unaddressed needs, and because maybe there's a better understanding, maybe some advances, there still is a possibility for continuing rehab. So the big challenge is we've done everything we can to fix it, so how do we adapt to the new me? The first thing is to grieve the losses, come to terms with I am not the same person, I don't have the same capabilities and so on. That's tough, it's painful. And I can tell you from my experience, a lot of people have what I call incomplete grieving. I've seen people who isolate themselves, stand in other people because it's a reminder of who I used to be. And so instead of coming to terms with it, they just sort of deny it. And they say, well, I'm not going to go out in public until I'm just as good as I used to be. And what if that doesn't happen? What if there's a permanent change? What are we going to do? So grieving the loss is very important. Talking about it with therapists, with friends, family, and so on. The other thing is appreciate the past. I try to appreciate what I could do in the past I no longer can do. I try to look at it and say, well, you know, I had those X number of years of being able to run or to ski or to play tennis or whatever. And I feel grateful I had the opportunity. Are you familiar with Marie Kondo, who's quite popular on organizing and decluttering one's home? She has a ritual of going through your closet and putting clothing on the bed and then taking each garment. And if you're going to use it, you put it in one pile. If you no longer need it, instead of just discarding it or putting it in a discard pile, you thank it. You say, thank you for the pleasure, for the help you've given me over these years. So appreciating what we had in the past, then coming to appreciate my current capabilities and opportunities. I can't do the same job I did. I can't be as helpful, but what can I do? What's left? What resources do I have? What am I capable of doing? Focus on that. And that gets me to two big areas. The first is how can I help myself? The second is how can I help others? My great belief is that the best way we can feel satisfied and better is to be able to do both. I feel proud about what I can do for myself that is within my abilities, and I feel proud about being able to help other people. Now, let me talk about how to help. I do not mean that I expect myself to make a contribution so that I get the Nobel Prize. No, I'm talking about simple, basic, but powerful things. Like, for example, being a good listener, being able to stand there and listen and acknowledge that you understand somebody else and give them the feeling that they're understood, they're respected, they're not alone. That's a good way of helping. So how can I help myself and how can I serve others? Most of us feel comfortable and fulfilled when we're connected to other people, family, friends, and so we want to find a way to do that. So one of the things in recovery that we want to do is educate ourselves. What is a brain injury and what can we expect and how do people usually maneuver and navigate recovery? I want to learn about this, so I want to read about it. Well, we know there are ABI classes. I know many of you have participated and benefit from the ABI classes. Online discussion group, like the Brain Injury Foundation has one, and hopefully people will take advantage of that, feel comfortable. The brain injury support groups, educational conferences or activities like the one we're having together today, and then reading about brain injury online. At the bottom of the search page, there are other resources, other websites that give up-to-date and useful information for survivors. Or send you a Brain Injury Foundation website, you can find those resources too. The other thing is tell our story. I think it's important to tell our story because it helps us process the experience the more we tell it and come to terms with these changes and adjustments in our life. And also we're sharing it so people can learn from our experience. Somebody who's maybe newly injured and a family who's newly injured, not knowing where to turn for resources and not knowing how to navigate with the system. Meetings, those are venues. Writing about it. At least one person and probably more have done some writing about their personal journey in recovery. Also videos. Anybody can put up a YouTube video that to share one's experience. I think it would be helpful, educational, and inspirational for anybody to do that. As I said, be a good listener. You know, it sounds pretty simplistic, and maybe it is, but in my thinking, it's powerful. I think that's one of the most important components for me of a doctor-patient relationship and any relationship, to just listen, try to be empathic, meaning put myself in the other person's shoes and try to reflect to them what they're experiencing. Wow, that was frustrating, that was disappointing. Wow, you must have felt so proud when you did that, what relief you had, whatever. Be able to reflect that back. And one of my favorite sayings is, don't just do something, stand there, which is the inverse of the common saying, don't just stand there, do something, fix it. Sometimes it's important to do something and take action, but you know what, probably more often than not, it's important to just stand there and be a good listener. How else can we adjust? Find a mentor. This is important at any time in life, I find. I remember the people who were really helpful in forming my professional identity, and I think the same is true of recovering from a chronic condition. Mentorship. What do I mean? Somebody who's newly injured, a survivor in their family. What if they're paired with somebody who is further along in the recovery process, a survivor, a family member, and they can trade notes, and hopefully the imparting the information from somebody who's been there will help the newly injured survivor stay on the right path, the right resources, maybe avoid some missteps, and then also the mentor will be there for emotional support. It's hugely important. I know Kurt has submitted a proposal for a grant to start a formal patient peer support program, and we hope that will be accepted and funded, and I would be happy to be involved in the implementation of that project. I want to talk about Henry's mantra, it could be worse. So who was Henry? Henry was my father. He had a good sense of humor, although it was corny, and his mantra, he'd always say, it could be worse. He'd say, Dad, how you doing? Could be worse. Later in life, he had chronic pain from a spinal problem. He got cancer, and I'd talk to him and he'd still say, it could be worse. In fact, a memory I'll never forget, his last hours of life, he's in the hospital, the family's around him. He's on oxygen, he's on morphine because of the pain and other things. One of our friends comes to the hospital room to visit him, and our friend felt awkward. Well, what do I say to somebody like that? And he says, Henry, how are you? So there's my dad, on oxygen, breathing heavily. And so my dad, who hadn't said much, he says, could be worse. So I think of that attitude and I try to emulate that when I feel frustrated and disappointed. I mean, look, life is full of these things. This restriction of the pandemic, the disruption, we get all these family events and holidays, all this stuff. I think of it, but I say it could be worse. Like, you know what? I've got internet connection. I've got power today. There's heat in my house. I don't have to boil my water. And the last thing I want is probably my favorite saying, and that is, the meaning of life is to discover our blessings, and the purpose of life is to give them away. What do I mean by that? Our blessings are our talents, our capabilities. That's what's important to realize, our creativity, to develop that and nurture and grow that, and then, of course, share those with our family, our friends, and the community at large. And to me, that's what makes life worthwhile and satisfying.